Hi everyone, my name's Danielle Galuppi, and I'm presenting on bulimia nervosa, which is one of the feeding and eating disorders in the DSM-5. Before I start talking about the specific diagnostic criteria, I wanted to bring to everyone's attention two important terms or ideas associated with bulimia nervosa. The first is binge eating, which is eating in a discrete period of time an amount of food that is definitely larger than what most individuals would eat in a similar period of time under similar circumstances. They classify a discrete period of time as being usually less than 2 hours. And I just want to point out that what may be regarded as excessive food for a typical meal might be considered normal during a celebration or a holiday. So individuals that eat a large meal during Thanksgiving or in a celebration, that wouldn't be classified as binge eating for this disorder. Also, binge eating includes a sense of lack of control over eating during these episodes. The next thing is compensatory behaviors, and these are behaviors that individuals engage in an attempt to lose weight. So it could be self-inducing vomiting, misuse of laxatives or diuretics, fasting, and excessive exercising. And I'll talk more about this later on in the presentation. So now going over the specific diagnostic criteria. Criteria A is recurrent episodes of binge eating. And then we discussed binge eating. So it's eating in the discrete period of time, a larger amount of food, as well as a sense of lack of control over eating. The next criteria B is recurrent inappropriate compensatory behaviors in order to prevent weight gain. Criteria C is the binge eating and inappropriate compensatory behaviors both occur on average at least once a week for 3 months. So this has to occur for at least 3 months. And then the disturbance does not occur exclusively during episodes of anorexia nervosa. Diagnostic features, again, there's recurrent episodes of binge eating. There's recurrent inappropriate compensatory behaviors to prevent weight gain. Self-evaluation that is unduly influenced by body shape and weight. So typically these individuals are battling self-image. There's triggers that are causing them to engage in these behaviors, such as dietary restraint, negative feelings related to their body weight and shape, and sometimes even boredom brings this on. Must occur on average at least once per week for 3 months. There's excessive food consumption, which must be accompanied by a sense of lack of control. So these individuals are unable to refrain from eating or to stop eating at times. So they may be engaging in this binge eating episode and they may be getting phone calls or other things are going on, but they're not realizing this. They're strictly eating and unable to be controlled otherwise. These individuals tend to eat foods that they would otherwise avoid. So a lot of people with bulimia nervosa on a regular basis are eating low-calorie foods, following a strict diet. And then, for example, when they're binging, they're getting fast food or, donuts, things that they wouldn't typically eat. Binge eating typically occurs in secrecy or in inconspicuous places. So, for example, individuals may be hiding out in their cars while they're binge eating. And just another thing, these binge episodes don't occur strictly in one location. They could start, for example, in the car on the drive home and then proceed to continue once the individual returns home. Binge eating often continues until the individual is uncomfortably and painfully full, and a negative effect usually precedes an episode of binge eating. Now to talk a little bit more about the purging behaviors and non-purging behaviors. The most common one is definitely vomiting. It typically starts as self-induced vomiting, so individuals are causing themselves to be sick. There's misuse of laxatives or diuretics, misuse of enemas, and some would even go as far as taking thyroid hormones to help prevent weight gain. Non-purging behaviors include fasting for sometimes a day or more, or excessive exercise. And by excessive, it means it's interfering with regular daily activities. Typically, individuals with bulimia nervosa are of normal weight or in the slightly overweight range. It does occur with individuals that are obese, but it's very uncommon. And again, between these binge eatings, individuals typically restrict their caloric consumption and follow a diet. There's menstrual irregularity, and this is sometimes a result of the weight fluctuations. There's nutritional deficiencies and also emotional distress that's associated with bulimia nervosa. Some of the rare but fatal complications are esophageal tears from the purging behaviors, gastric rupture, cardiac arrhythmias, laxative dependencies, and gastrointestinal symptoms. Typically, bulimia nervosa does not occur before puberty or after the age of 40. The 12-month prevalence among young females is 1 to 1.5%, and it's highest among young adults. This disorder typically peaks in older adolescence and younger adulthood. It's less common in males than females, and it does occur in males, but it's less common, and it's a 10 to 1 female to male ratio. Commonly, this disorder begins in adolescence or young adulthood. The binge eating frequently occurs during or after an episode of dieting or weight loss. The course may be chronic or intermittent, with periods of remission alternating with recurrences of binge eating. There is significantly elevated risk for mortality for individuals with bulimia nervosa, and there's a 2% mortality rate per decade, and this includes suicide related to this disorder. There is crossover from bulimia nervosa to anorexia nervosa in a minority of cases. Some of the risk factors are weight concerns, individuals with low self-esteem, depressive symptoms, social anxiety disorder, and over-anxious disorder of childhood. Many individuals are internalizing a thin body ideal. Some of the other risk factors are childhood sexual or physical abuse. Also, some of the genetic and physiological risk factors are childhood obesity and early onset of puberty. This disorder occurs similarly in most industrialized countries, and individuals presenting with this disorder are primarily white, but it also occurs in other ethnic groups. There is no specific test to test for bulimia nervosa, but there's several laboratory abnormalities that occur in individuals that suffer bulimia nervosa. This concerns some electrolyte and fluid abnormalities, specifically low potassium, low levels of sodium, and this is because individuals are nutritionally deficient. There's loss of dental enamel due to individuals purging, and there's parotid glands may become notably enlarged. These are the salivary glands, and then some individuals even develop calluses or scars on the outside of their hand as a result of making themselves vomit. Suicide risk is elevated in bulimia nervosa, and there is definitely a comorbidity with other mental disorders. And most individuals experience at least one other mental disorder and may experience multiple other mental disorders in conjunction with bulimia nervosa. There's increased frequency of depressive symptoms and bipolar and depressive disorders. And the lifetime prevalence of substance use in individuals with bulimia nervosa is 30%. All right. I hope everyone enjoyed the presentation. Feel free to reach out if you have any questions. All right. Thank you.